Kenya is among the first African countries to achieve World Health Organization Millennium Development Goal for case detection and treatment of tuberculosis. However, the fight against tuberculosis is far from over. Nearly 2 Kenyans die each hour from tuberculosis-related complications, and another 19,000 succumb to the disease annually, despite availability of effective treatments, according to a study by the World Health Organization.
We know if you are HIV positive in your lifetime, 50% of that population will develop tuberculosis. And every year, 10%, there's a 10% risk.
Samuel Maina, a resident of Nairobi, has gone through an agonizing experience. 5 times he has been diagnosed with TB, with each treatment failing to produce a cure.
The 50th time, when I went to Cambridge for test, I was done some culture, and the results came out I have MDR TB.
Subsequently, he lost his job and had to live in isolation for almost 2 years to avoid spreading the airborne disease as he received treatment.
Most of the doctors, they recommend you to join your family freely after you complete your treatment completed. That's after 24 months.
To turn the tide, Kenya will be aiming to invest in programs to reduce TB-related deaths by up to 90% and an 80% reduction of new cases by 2030. The UN will in the next 15 years spend $2.5 trillion on 169 global development targets to help pull hundreds of millions of people across the world out of poverty and improve healthcare systems. But Dr. Bjorn Lomborg, the president of the Copenhagen Consensus Center, a think tank of top world economists and researchers, says attaining this goal may remain just a pipe dream for many countries, including Kenya, unless the government reviews their targets to at least 19, among them reducing TB deaths.
In a political conversation, it's probably rather going to be 30 or 40. That's still amazingly much better. Our analysis show you'd still do 3 times more good for every shilling spent if we focused on the top 40 targets.
Experts estimate that every shilling Kenya spends on increasing detection rates, strengthening primary healthcare provision, and treating more TB patients will give benefits worth at least 5 shillings, as well as save lives in Kenya, and that by spending about 6.7 billion shillings a year would give each TB patient approximately 31 years extra of life, translating into increased lifetime earning for the population.
More productivity for Kenya, starting a virtuous circle where they, of course, will get kids that are better fed, will be better educated, and will have a nation that will be richer.
Yambo reporting for Channel 1 News.